today we're talking about Botox and Dysport. I have only ever had Botox. Have you had Dysport?
No, I've only had
so we're
Botox
both Botox girlies.
Yes. Mm-hmm.
Fair enough. My first encounter with Botox was in February of 2021.
Mine was I was right before I turned 40.
What?
I know.
You've been doing Botox for that long, and I don't think I knew.
I did it before I went on a cruise. Yes, I would turn right before I turned 40. I had it done, but I hadn't had it. So I had it done that one time, and it lasted like 8 months, almost a year. So that's why this time, and it didn't last that long. I felt cheated. I think they changed things.
You think the formula is different?
I think they give you, anyway. So, but I've only had it 3 times.
Maybe.
In the last 2 years. So once back when I was 40, and now I'm 53. So I've had it 3 times in the last 2 years or so. So
I did it that February, and at the same time I let them put, and I think it was Volus type filler. All the fillers have different consistency, I found out. And like thickness of them, and depending on where you're putting them changes which one is most recommended, whether it's lips or against a bone in the cheek or in the chin. And so they put one here because I had terrible 11s.
I remember.
They were bad.
I've had it all
since I was in my 30s.
Yeah.
Maybe when I was in my 20s when we first met, I didn't have it yet.
I think you always had, because when you would concentrate back in school,
it would get there.
You would get them.
I just constantly looked confused.
Yeah. Well,
or angry. I don't know. One of or both, probably. But I had such deep furrows, and I remember I would notice them in my rearview mirror, and the only time they would go away from the time I was even working with Eli at the herb shop was when I went to yoga class. Huh. My face would relax enough that the deep groove would kind of go away. I probably should have started with Botox back then.
Maybe. To
keep it from getting so bad.
Right.
Now I have filler behind it. And let me tell you, that was February 2021. I have not redone that filler.
It looks good.
It's lasted this whole time. I'm the best thing I ever did.
Does it move around?
It must have adhered right to my brow bone.
Right.
Because it's in there, and let me tell you the weirdest thing. When I get Botox, I feel a little swelling around it, and it looks like it's fresh again. When I got my COVID vaccine, my fillers swelled up. This swelled up like I had fresh filler. I think my vaccine extended the life of my filler. That maybe is a trade-off. But,
okay, well, I'm not going to comment on that.
No,
because
you don't have to.
We are not doing politics in this.
No. I just found it interesting. It created some sort of allergic reaction. And then I read online that fillers and whatever is in that vaccine or vaccines in general maybe, can have some sort of interaction.
Okay.
But it wasn't a negative one. It just made it look like it was fresh, like it was a little more full in that area. And when So I had Botox again in July of that year. And then once more, I think in November. So I had 3 times in a row Botox, like every 4 months in 2021. 2022, I didn't go as much. I went to 2 other practitioners, and I cheated on my doctor to try different things. People I had seen because TikTok became more popular.
Right.
One did this area for me, like a lip flip and all down here only.
Right.
And then the other one did filler finally here and here, which my friend was becoming an injector nurse, and she was practicing. And they wouldn't even do any Botox that time.
Right.
Because they wanted it to all wear off. That was like last October.
And it hurt.
October 2022. This did not hurt. It had lidocaine in the filler. It just numbed it inside.
I think you have a higher pain.
But I did feel like I was hooked like a fish. Because she had my lip and, like blade pulled out like this. And then the needle, she was guiding it up in here. It's pretty graphic.
Okay.
So my advice is be ready for something that's not like a simple procedure, but not intense either.
Mm-hmm.
It's somewhere in the middle.
So it's going to hurt.
Maybe. What you guys are going to see as part of this episode, if you're on YouTube, is I have clips of me receiving my most recent Botox, which was just a week ago. Dr. Moen, who is my usual Botox doctor, not one of the ones I cheated with, did a full face for me about a week ago. And so you guys will be able to see his take and his opinions on why we use Botox, what it does for your face as far as balancing the face, and also get to see how it looks going in.
Right.
You know.
Yeah. I don't have that video.
That's okay. We only need one.
I know. I was going to.
Well, I mean, yeah.
Yeah.
It's okay.
It hurt too much.
It was painful.
It was.
It wasn't like a walk in the park for me. I will say that. So, how does Botox work? What do you know about it?
I know that it paralyzes the muscle.
Yeah.
That's it.
There you have it, guys.
And botulism. That's all I know.
5-minute episode.
So, yeah.
No, it does paralyze the muscle. It blocks one of the like acetylcholine or something that causes muscle contraction.
That makes sense.
And it's interesting because they say the more you get Botox, it causes the muscle to weaken and it won't come back as strong.
Well, that's why young people are getting it now, right?
Yeah, it's more, well, I think young people get it as preventative because the wrinkles don't have a chance to form in the skin.
Right. But we're past that. So
moving
on. Yeah.
What the doctor goes into in the clip that you guys are going to see is that if you have, he called them kinetic or something, sounding fancy, but if you have lines that stay there when you're not moving, those are the ones that probably need something more filler oriented or lifted. And if you have lines that show when you move, those are the ones that Botox can help because it's the muscle driving it.
Right.
So these forehead lines, which I can't do now.
Right. Well, I still can do a little bit.
Right.
But not.
That's a Botox effect.
Yeah.
But my deep grooves, he said, it'll help a little, but it won't give you the result you're really looking for.
Right.
And so, and down here, there's not really anything Botox can do for these for me. I'll probably have to have surgery on that eventually.
Yeah, me either.
But the crow's feet, definitely. Yeah. When you crinkle, when you smile.
I still see a little bit here. I might have to have them up my...
So one thing to remember, if you guys, a lot of people have used Botox, and if you're naive to it or new to it, most doctors or injectors, sometimes they're nurses, recommend at 2 weeks, you either do a virtual or you come back in and they'll do a touch-up. Really? For any places, you need to demand it.
I'm going to.
Demand your right.
I will.
And it shouldn't cost you anything.
Okay.
So it's basically just looking to make sure something's not lopsided or moving too much, and they can put a couple more units there to freeze it up even more. If something is lopsided, I guess they can go to the antagonist muscle and paralyze it a little bit so that it'll bring it back to balance.
So if you get the droopy eye, they can fix it?
Well, the droopy eye I hear is impossible to fix because there's not another muscle going.
Well, I know.
But they do have the Upneek drops.
Right.
They recommend that for people who have a bad Botox outcome. Sometimes Botox, it doesn't even rely on the injector's capabilities.
True.
It can sometimes cause side effects where you do have some unevenness. The beauty of it is it wears off after 3 to 4 months. Right. You just have to go into hiding.
Up. Yeah, you're jacked up. But no, I think that's fair to say about any procedure. You need to go in.
I mean, you have to have a good person doing it. Get your reviews, do your research. But also sometimes bad stuff can just happen and you might be the unlucky one. We've seen plenty of examples of that online too. Right. People report that.
I've known many people get it and none of them have had it.
It's rare.
Yeah, it's rare.
The other thing is, and remember 2 weeks, get your follow-up appointment, touch up.
I'm 3 weeks now, right?
Yeah. So you could call them and I have a couple lines that are showing and I want to.
I think so, right?
Yeah, I can see it.
Yeah.
And then like next week, I'm going to show him mine when I'm in his office for something else. I don't really think I need anything right now, but I want to give it a couple more days to settle.
I mean, I'm overall happy, but I just noticed those right there and right there.
Mm-hmm.
But they were pretty deep to begin with.
Right.
So
my concern a little bit is I have these DAO muscles for the first time injected, and I just want to make sure that they're even. I don't want to be.
I mean, I had mine and I can't tell.
It looks good.
Okay, good.
But I just, I don't want to be smiling crooked for 4 months if I can help it. So, Dysport is the alternative to Botox. It's also a neurotoxin. I think it's also made out of botulinum, which comes from a bacteria. So they actually cultivate the toxin from the bacteria and create a pharmaceutical out of it. They kind of clean it, sterilize it, put it into this other medium, and then make it injectable. But Dysport, I guess because of the carrier that they put with it, it takes effect within a couple days instead of 2 weeks.
Right. See, I hear all sorts of misinformation because I had heard that Dysport lasts longer. But then when I went on the Google, that is not true.
I think it depends on the person's metabolism.
Right. Well, when I was working out, last year's didn't last that long.
Yeah, because you were exercising.
Like 2 months, 3 months. But this last one, or the middle one, lasted longer.
I talked to people, patients of mine, who've said that the Dysport for them lasts longer, and we think maybe it's just and Botox didn't. Then I've had other people who said the reverse.
Right.
And
I had the coupon for the one, so that's what I
yeah, whatever.
That's right.
Or the points. You get the points too from Ally or Ally. I don't know. Ally. I don't know. So there's manufacturing discounts from both companies, and you can become like a loyalty member and get points and use those towards your treatments. And there's also all the time people running specials, but I wouldn't run out and go and get the cheapest Botox you could find.
Right. I wouldn't get the Groupon.
No.
Well, I might have done that when I was 40.
Yeah. Well, you have a little bit less to lose.
I can remember now. No. I found the best. I went to one place and they did a fine job, but then I found the best person in my area. She trains all the local doctors. Yeah. So I now go to her.
Awesome.
Yeah. I will find the name and
we can put it. We'll put it with the episode.
Yeah.
Or I'll insert it later.
I'm on the other coast. So.
Right. If we haven't talked about it before, I'm in Los Angeles, or the greater Los Angeles area, and Julie is over outside Atlanta.
Right.
In Peachtree City.
Yeah, Peachtree City.
Is that your proper address?
Yes.
Okay.
Yes.
I mean, not to give away your location.
That's all right. You can.
You're not that anonymous.
No. You can come down and try to find me.
I think you could probably Google her too.
Probably. Very.
So, the whole idea behind this is to reverse aging a little bit and prevent. I feel like I'm delaying surgery is all I'm doing with Botox. What about you?
Yeah, I would agree. I just, the wrinkles just were getting, I would look at myself in the mirror and not recognize myself.
Yeah.
So it does really help.
Smooth all that out.
Especially here for me. This was the worst area.
The forehead. Mm-hmm. For me, it was definitely the 11s, and I don't really care about these so much, but the doctor loves to do it, so I let him.
Well, I had the droopy eye, so
yeah,
eyelid.
I'm talking about like the little crow's feet.
That doesn't bother me as much either.
I feel like those are okay.
No, but the lip I love. The lip flip.
I didn't get that this time.
I did. Well, because my lips are thinning out a little. Well, they're not thinning. This one's curling under, I guess, is what they say. And I do really like how it
lifts it up just enough.
I have a little bit of a gummy smile, which I've always hated, and it supposedly helps.
Takes care of that.
Yeah, because you can't smile as much.
Big.
Yeah.
I had mine done here because I have a fish mouth.
I do. Well, I do too. I don't love it.
And then I have this prominent chin also, and they can do it here in the crease of your chin so that this doesn't stick out so far and look. I don't know. Maybe that
I never noticed your
not prominent like a big chin, but there's like a very defined.
I mean, it's better than the opposite.
No chin?
Yeah, no chin.
Do you remember those people in high school that would get that surgery to get their chin?
No.
Oh my gosh. They would get their jaw broken and it would pull because they would have a weak chin.
I lived in small town
The
New York.
lower bite needed to be pulled out a little bit. So they would break their jaw and slide it out, and they'd have to have their jaw wired shut for like 6 months, or I don't know, 3 months. It happened to a couple of girls in high school, and they really did have that chin that just slopes back down to their neck. And they were, 15 years old.
Yes, that's terrible.
It was awful.
It is awful.
Brutal, really. But I don't think there's any way to fix it still unless you get chin filler,
I thought
implant.
They could do an implant.
Yeah, but does that really fix like this underbite problem?
This is another episode for another time.
It's for our dental episode.
Yes.
We'll have to get a cosmetic dentist on.
Yes. Of course, they wouldn't do the chin.
The jaw. Well, they'd probably be an ortho.
Is there
a
plastic surgeon ortho?
Oh, I don't know.
All right. Well, anyway,
we're going to find out for you guys.
We'll find out because now we need to know.
Or you can write in and tell us how wrong we are.
That's true. I'm sure.
About anything, really.
If you're a plastic surgeon orthodontist, then please.
Cosmetic orthodontia. That's the thing.
I'm sure.
Yeah.
I don't know.
For sure, that's the thing.
I want to get some new veneers, though. So if you are one and you're on the East Coast, we can talk. Or you're on the West Coast. I'm over here a lot.
Yeah, we have to have a whole dental episode for sure. Definitely. We'll kind of delve into all those things.
Okay.
Botox. Now, let's talk about neurotoxins are for relaxing wrinkles and not being able to make those faces that are enhancing our wrinkles, but it's also got a medical purpose that we haven't even touched on. People will get injection in their masseter muscle. That's the muscle that's responsible for chewing, their temporalis, and even back here in their back of their neck.
Right. What's that?
For headaches.
For headaches. I hear that a lot.
Also the traps.
Do they get it for the TMJ? Is that why they
probably? Yeah. Headaches and TMJ would be for here. And then in the traps, you can get it also to help with like tension headache. But the other thing they do is if you have a wide neck and high traps, they will inject them so that you get the slender neck appearance.
I want to get that.
You didn't know?
No, because I have that, what do you call that weird, like I feel them. They're big, but they can't do anything with this.
Yeah, that's what they do. They inject that and it sinks down. And your neck looks way longer and slender.
All right, I'm going to ask.
Trapezius muscle injection.
No, I know that. Okay, I'm going to ask my girl, my esthetician.
Oh, this will be another well, how are you going to tolerate the pain? You know what? I don't think this is as sensitive.
I don't know. Well, you know what? I'll power through.
Yeah. Okay. They'll give you some lidocaine.
No, they will. She's never offered it yet.
Well, you're gonna have to ask.
I have the NOS tubing.
Because these are so strong, like from lifting your shoulders.
Well, yeah,
it takes quite a bit.
Well, because I have a big head.
I didn't mean you personally.
Well,
I meant in general.
Yes, but when you look at people's bodies, and a lot of us have that. Like I see some people with these beautiful shoulders that are straight across, and then I have this the European.
Yeah. Like you've been carrying jugs of milk
in the field. Yes.
Milkmaid body.
Yes. Yeah, but without certain attributes. So I'm just a hot mess. Picking turnips. I don't know.
So yeah, there's injections here in the traps.
I'm learning things.
To elongate the neck. And then they will also inject the neck bands here.
I need to get
to relax these. So that there's less of this wrinkling here.
Oh, wow.
And then they use Botox for sweating too.
I did know that.
So they will put it in the palms of your hands and your armpits. I can't imagine the bottom of your feet. Oh.
Well, if you're sweaty there.
So it can stop sweating. And to that same effect, it stops the sweating on your face. Have you ever noticed that your skincare and facial makeup lasts longer after Botox? Maybe you didn't notice.
Well, I'm not a huge
face sweater.
I don't sweat as much as the normal person, but no, I guess now that you say that, yeah.
They've discovered that it reduces the amount of oil that's released on the surface of your skin as well. So your skin actually gets a better texture and appearance from the Botox injections. And the fillers have collagen in them. They're made with hyaluronic acid. So as they break down, it's supposedly feeding the collagen in that area. So it's really like a health food.
Okay. It's expensive.
It's an expensive way to get some nutrition in your skin.
Okay. Oh yeah. Okay.
I mean, how could you not do it
That's
at
right.
that point?
We almost have to.
You're required.
So how long does filler last?
Well, it's up in the air, I think.
Okay.
Because this so far, I mean, data point of 1 is going on 3 years.
Right.
They say lips you have to get done about every 6 months to a year.
I worry about the lips because I've seen some bad.
It migrates, I've heard.
Well, and it's easy to go
too far.
And I think it's.
You can always have it dissolved, but then I saw someone on TikTok had a reaction to dissolving the hyaluronic acid. Hyaluronidase is the stuff they inject to dissolve your filler.
Huh.
But plenty of other people have had it done
Right.
and no bad effect. They use an ultrasound to find your filler and dissolve it. And they recommend, there are doctors I've heard speak who say you should go in and have all your filler removed before you start adding new. Just because otherwise you're going to start getting these filler pockets that have drifted. And then you'll get that puffy pillow face appearance.
That is one thing I have a fear of it's just, I don't know what it is, but they have
it starts to get a weird look, huh?
Yeah. Like that, what's that bad guy in Saw? Got the
Jigsaw?
Yes.
The one on the little bicycle?
Yes, with the round cheeks and the.
Right,
Yes,
right.
Jigsaw.
That's from probably poorly done cheek filler.
Yes.
Or maybe even a bad cheek implant. I don't know, but
I do sometimes when I walk into the place I work to, when you get it done, some women are just, it's a little too much. And I always say I want it to look as natural as possible.
Well, our podcast is called Aging Gracelessly, but we're going to be as graceful as possible with our filler placement.
True.
Putting filler on top of filler isn't a good idea, I guess, is the take home for that. And Botox, you need to wait the 4 months before you start going in with more, they say.
Okay.
That's what they told me recently. They were like, don't start adding Botox on top of Botox because it's going to wear off at different times. And you're going to get into a weird cycle.
Right.
Where you don't have this, you can't treat the whole face at once.
Right. So that's why you got to go 2 weeks to get it fixed. All right.
A little bit. Yeah.
Okay.
So other than that, I mean, what else do we have to talk about? Botox and Dysport and all these things.
I guess that's it.
That's it. We've talked about the medical uses. We talked about some of the side effects, the negative and the positive effects as well. I think that rounds up this episode.
I think so. I mean, we didn't really talk about price, but that's going to vary.
I think that varies so much. We can talk about it, but it's anywhere from $8 to $14 a unit for Botox.
Right.
Here.
That's so for me, it's usually 9 to 12, but it's so confusing because you think, oh, $9.
Well, it depends cheap. How much units you need.
And then they're like, well, you need 100 units. So yeah,
they get you. It's always going to be about $500 to $1,000 every time you go.
Right. So that was the hard thing. When I was working out a lot and it would wear off in 3 months, and you're just like, oh.
That's what you get for doing the right thing.
I know.
Oh well.
Well, you can be fat with no wrinkles.
Literally.
Thin.
The fat fills the wrinkles, and the workout also keeps the Botox in place. There's really, in that Barbie movie, when they said how hard it is to be a woman, she wasn't lying.
Yes, that's true. That's true. But she gave it all up at the end to.
She did. Well, no, it wasn't. It was,
to be a real woman.
So. To be a real woman, even though it's hard.
Like her, it wouldn't be that hard.
If you're Margot Robbie, it's really kind of a toss-up whether it's really a struggle. Okay, thanks, guys.
Another question that often comes up for people who are learning this is how much Botox do I inject? And that's a very complicated question to understand. It depends on what the expectation is. If somebody wants to be completely frozen or somebody wants to be a little bit, have some motion still. So you have to keep those things. The second thing is where the brow position. And you have to understand that because if you do too much, then the brows are going to fall completely. The other question is what product are you using? Because there's semen, and each of these have different unit measurements. We try to typically resort to using one type of product so we have complete familiarity with their scope of effectiveness and to be able to produce reproducible results. Unfortunately, Botox is a little bit painful, and we use a device that vibrates, and this vibration, when it touches the patient, it sort of causes the nerves to be confused and the patient not to feel the pain as much. And we typically first ask the patient to frown please. Complete, yeah, nice frown. And then we look at our insertion site and we inject. So this is the Proceras, this is the colligators. She's got a pretty good size colligator, so we can inject it 2 places. Frown again for me. And this is the nasalis. You want to put enough pressure on these so it doesn't bleed. Raise your forehead, please. So do you see this? Do you see how her brow is raised? Do you see? Like, I'm not gonna go and put something over here because I want her brow position because she's already low. So we want to avoid Botox in those areas. She will still have some loss of her brow position, but not to the degree lift up. Okay, now we're going to do a little on the side. Straighten. Relax. Now, because her brow is a little bit low, I'm going to release it by adding a little Botox to her brow peak. This is a non-invasive way of raising the brow. Just so like, I'm going to do 2 positions. Put a glove on and help me in these. Yep. Just kind of waiting. Just, and usually these are point. Let's switch. So again, I'm putting an injection right over here. Putting an injection right over here. I want to raise your brow, so peak, lift up, lift up, lift up. See where it peaks? Now close your eyes. Squint, I want to, yeah. See, so I'm trying to figure out where is the maximum area that I can be effective. So just slightly over here, I can raise this, I can give her a little balance. And that's by releasing the muscle, the auricularis oris function that closes that, okay? And the last part that she's interested in is called depressor angularis oris. Depressor angularis oris is what causes the corner of the lips to come down. And there's a couple different things you see over here. You see a shadow over here, so there's a divot. And that indentation can be filled with filler. That will improve that. I'll take that from there to something like this, okay? But then the balance of where the corner of the lip is dependent on several muscles that insert to the corner of the lip. If you can paralyze the muscle that pulls it down like this, then the muscles that pull it up are gonna take over, and she's gonna have a much better
I have a
angle.
little filler
Yeah.
in both places, but
It's not working as much.
it's not
Yeah, and
They put a tiny bit here too, like to
Yeah.
kind of,
yeah, that's something that at some point we have to address.
yeah.
It will help slightly, but you know, part of it is what it is.
Yeah, it's
and
gonna
we
have to
can-
let go
Yeah,
eventually.
but it does help to add a little bit of Botox to the corner.
Mhm.
Now, this is tricky because there is nerves and there is, if you put it too high, it can spread over here and cause problems with the corner of the mouth. If you put it too low, it causes other problems. It's ineffective and doesn't work well. So we have to first feel the muscle. So do this for me. No, I want you, yeah. So I'm feeling the muscle action. So again, so I'm feeling the muscle action and I'm putting my finger to clearly see where the insertion of that muscle is, because I have to go slightly higher than the insertion point, not so close to the corner of the mouth, because that's a problem, because it's gonna balance, it's gonna ruin the balance. It's gonna paralyze both muscles. So I have to, and the coefficient of spread is 1 centimeter. So you don't want that. So I'm coming down over here and it's right over here. Now, again, now relax. So the depth of the needle, this is a deep muscle, so you have to go down deep. And then I put half, I do the same thing. Again, frown, relax. Okay, that's it. And that's a full Botox